Hi, class. This is your lecture on Chapter 17 Drug Use, Forensic Toxicology, Workplace Testing, Sports Medicine, and related areas. So, today we're going to focus on chain of custody and workplace drug testing. Laboratories are legally accountable. What does that mean? Well, laboratories that perform tests for legal and forensic purposes or for drug abuse are legally accountable for the documentation of the handling of the specimens or evidence within the organization. This is very important, you guys. It's very, very crucial that this um, chain of custody is followed, okay? Um, it can ruin court cases by having evidence contaminated. The documentation begins the moment, keep that in mind, that the specimens are received from the donor of the specimen or from the medical examiner's or county coroner's office or other authorized individuals. That means right when that specimen is received, not after lunch, not the next day, not after your break. Okay? So, what is the chain of custody? The chain of custody is the process for maintaining control of and accountability for each specimen from the time it is collected to the time of its disposal. Okay, and if anybody has ever been to uh, court, to a hearing, especially a criminal case, or watched Law and Order or something, you've probably seen the brown bags, brown evidence bags. Okay, that's these have to follow a chain of custody. A chain of custody form is required. It is a must, must, must. You must have that chain of custody form. It has that form will contain the specific identification of the patient, the subject or deceased person, the person who obtained and processed the specimen, the date, the location, and the signature of the subject, documenting that that specimen in the container is actually the one that was obtained from the person identified on the label. Okay? So let's test yourself. What is the purpose of the chain of custody? Choose your answer from A, B, C, or D, and then you'll submit this answer along with any other assignments within the video. Okay, so your choices are A, the chain of custody. The purpose of the chain of custody is to make sure a child does not get away from their parent. B, the purpose of the chain of custody is to make sure no links are broken in a chain. C, the purpose of the chain of custody is to make sure all like specimens are placed together. Or D, the purpose of the chain of custody is to keep control and accountability of specimens from collection to analysis. Choose the best answer. So, how do you package the specimen? The specimen must go in a specimen transfer bag that is permanently sealed until it is opened for analysis. So, it's not your ordinary lab bag, okay? The seal ensures the tamper evident transfer of the contents until the specimen gets to its destination for analysis. So, once you seal these evidence bags, they are not to be taken apart again until they reach their destination. Okay. Forensic specimens are accepted in any condition. So you know when you get when you actually draw specimens in the lab, well, you're under a controlled environment where everything is all nice and clean and sanitized and everything. Well, in criminal cases, uh, you have to accept that those forensic specimens from at any time um, they could be contaminated with all kind of um, stuff from being out in the weather. They can be brought in any non-traditional containers. I mean, it may arrive to you just in a styrofoam cup. You may have clotted specimens, but however those specimens are presented to you, if it's a forensic specimen from a criminal case or something, you must accept those specimens um, in any condition in which they arrive to you. Now, the healthcare worker's role in these cases are to cross-check the requisition from the medical examiner's office with the name, the age, the sex, the case number, the types of specimens collected, and make sure everything matches up, okay, with the labeled evidence. Labs also use a chain of custody in workplace drug testing protocols. So the role of the healthcare worker in these situations is, as the healthcare worker, you must be trained and evaluated on using the federal guidelines, and also you must stay up to date with current policies. Healthcare workers must know the identification processes. You must also be able to properly give the clients proper instructions for specimen collection and handling. You must be able to monitor and document all circumstances that might indicate adulteration or substitution of specimens. And you must make sure that the copies of the chain of the custody and control form or CCF forms get to the correct destination, and that includes a copy for the employee being tested. Okay, so here's another assignment. So you're working in a lab and you have been there for 10 hours of your 12-hour shift, and it's time for your 15-minute break when a policeman arrives and needs a specimen collected on a patient coming in by ambulance for drug testing and alcohol level because the patient has just been involved in a fatal vehicle accident. You get the blood stat as requested, label the specimen, and then go on your break. You will complete the rest of the paperwork after your break. Surely it would be no problem, right? Because at least you got the blood. Well, what's your response? And explain your answer. And that's all I have for you guys today. I will see you next lecture. Bye bye.